very good evening to everyone. This is 5 p.m. and on this platform, very thoughtfully created by misohe, I would like to welcome a very prominent psychiatrist, a very good person for the past 35 years. He has given a lot of his very focused and determined work to help certain sections of society make their own lives better. He has been the past president of the Bombay Psychiatric Society. His major contribution include creating that particular task force in the Indian Psychiatric Society, which gave the white paper on homosexuality not being a disease by the IPS. And that particular white paper was used by the Supreme Court to repeal the draconian and outdated Section 377, which gave a lease of life and an absolute breath of fresh air to a marginalized community. We are very privileged. We are very lucky to have this very senior, very eloquent, and a lovely human being who I'm proud to call my personal friend and mentor, and whose entire list of achievements, if I were to start narrating, probably this session would be used up for that alone. But without further ado, please help me welcome Dr. Kersi Chavda from Mumbai. And we welcome you to the platform, sir. How are you doing?
Good, thank you. Thanks so much, Satyen. And I don't think you'll be introducing yourself. So let me say a couple of things about you. So Satyen is a young man and he brings back memories of how we used to be when we were young and we wanted to change the world. And it's so lovely to see youngsters doing all that they're doing in the field of mental health. We talk of the marginalized society. We are talking of a marginalized part of medical health, which used to be psychiatry. Fortunately, today it has changed drastically. And with youngsters and seniors taking it all out to the masses, talking about the importance of psychiatry, talking about the fact that about 25% of the population at any given time is going to have some kind of psychiatric illness, and they certainly need to be looked at. I think we're going to have a change in the way we look at this particular field. So Satyen has also been past president of the Association of Private Psychiatry for Punjab and Haryana State Branch. He has a huge field of interest, which includes the very, very frightening aspect of drug addiction and substance abuse. And he does a lot of work also with kids and adults. So over to you, Satyen, now.
Thank you so much, sir. As I said, I enjoy a personal rapport with you, and you are a friend. And I thought, who better to talk on this topic of today, which fortunately you are also the chairperson of the National Task Force on for the Indian Association of Private Psychiatry on college mental health, right? So, Dr. Kersi, let's begin at the very beginning. I think when that lockdown happened last year, a lot of things in education changed, probably permanently and for good, right? How has this journey of college students been from the days the COVID lockdown started? What has been your experience?
Okay, so if you're looking at how it first started, I mean, initially, I think everybody was thrilled to bits because they said that they won't have to go to college, they'll be able to sit at home, there'll be online classes, they could get up late, etc., etc. Now, at least in Mumbai, we live in very, very small flats. So supposing you had a place where there were two people who were working online, and then you had maybe a youngster or two doing online studies, and you might have an older person who's also in the house because we have extended families. And suddenly there is no place. I mean, it's amusing for a week, a month, 2 months, but when it goes on for more than a year, we're seeing a lot of change. So we won't go into what the changes are in terms of adults, but if you're looking at college students, because this is basically geared towards that, what are the things that we have seen? Number one, we've seen an enormous amount of anxiety. The anxiety seems to be associated both with the fact that they're doing online studies, the fact that examinations seem to be a problem, the fact that there is an issue related to whether they'll be able to go abroad, whether they'll have a NEET exam, whether they'll have a joint JEE exam, and so on and so forth. We are also seeing an enormous amount of depression. Now, Satyen, you and I know that today, with the huge amount of research that has gone about, we find that there is, if you have a genetic tendency towards getting a kind of psychiatric illness, then the chances that the progeny will have it goes up substantially. And what we have found, and what we keep finding, is that there's a huge number of people now who might have been somewhat in equilibrium in the past, who had coping skills, etc. But with this enormous stress that has come about, suddenly the coping doesn't seem to be effective, and they kind of topple over, and they'll end up having either anxiety or depression or one of the other psychiatric illnesses that we are looking at. So we are seeing a lot of that. I'm seeing a huge amount of aggression in adolescents and the young college-going child. I guess, we always did say that it was necessary for kids of that age anyway to go out and, get out and do physical activity and get out and, go out into the sun and so on. And suddenly all of that had stopped. Now, a lot of our cities are opening up, which is helpful. But then we are also scared that this opening up should not lead to another wave coming in. And sometimes the visuals that we see on television are frightening and they're stupid, and we should not act stupid. But if you're looking at youngsters and suddenly there's no access to the gym, they can't go down and, go out, meet their friends, colleges are shut, schools are shut. Very often there are financial issues, so that if the parents maybe lose a job, the amount of money coming in becomes less. So automatically your lifestyle changes and it becomes less lucrative. I mean, you can't go out for coffee and you can't do a lot of things that you used to do, that causes its own attendant problems. And often we see aggression. Now, aggression used to be towards the fact that you get the most vulnerable person in the family. And we used to first see spousal abuse, which we are seeing a lot of. We used to also see a huge amount of child abuse. But today, my colleagues and I are finding a huge number of people, young adults, who are becoming aggressive towards their parents and even their grandparents. So it's a horrible state of affairs where you see youngsters who are actually getting aggressive or hit or push their mothers, fathers, grandmothers, because they just can't cope with the stress and the frustration that they're experiencing. Now the thing is opening out and we have their own attendant problems. So suddenly we don't know whether the vaccine is available or not. There seems to be problems sometimes. I mean, in my city over the last 3 days, suddenly there's a huge shortage of vaccination, and they promise that it's going to start from Monday, and we're hoping for that. Because when the vaccination was going on, it gave us a kind of feeling of security. We don't know. Then there was the whole thing about the side effects of the vaccination, which of course is a whole bunch of garbage, and we have to go ahead and get vaccinated anyway. Then it became, should we open order schools and colleges? And now we have some schools and colleges talking about it at least. Exams, are they going to be held? Are they not going to be held? So you have the 10 standard kids and the 12 standard kids, and the 10 standard exams were postponed and the 12 were cancelled, and the 12 standard exams were initially postponed and then cancelled. And it's a sad state of affairs. I mean, you and I remember in the 10th and the 12th, we had a lot of fun. So you'd go to school. It was the last year of school in the 10th. Your teachers were a harried lot, but you had a great feeling that you were in the top standard of your school. Kids look up to you, etc., etc. And then all of that becomes an issue. The 12th standard, it's very, very bad, because you have a whole bunch of kids who otherwise would have appeared for an entrance exam, and now they don't know how the entrance exams are going to be held. Sometimes people believe that if you have an online exam, there's going to be rampant copying, and we don't know whether that is going to happen or not. We also have a lot of kids who are happy that they don't have to go to college or they don't have to go to school. But I think the majority are not very happy, and I'm sure the parents are not. But then the parents are also frightened. They don't know whether when the colleges open, will there be again an upsurge? Will our kids going to get affected? Is there going to be a problem again in terms of, getting the illness, lining up in hospital, having problems related to drugs, having problems related to oxygen supply, all of those things are frightening. We are looking at the economy, and a lot of our kids, I mean, we are, you and I are privileged in that we have access to a lot of things. But then we have a lot of kids who don't have access to the digital world. And this digital divide is becoming more and more obvious. We see that tremendously in our school situation. We are also seeing it in colleges. So the aspect of inequality, which we were trying to actually narrow down, is becoming more and more prominent. And now we've got the digital divide in addition to the other divides that exist in society. So all in all, the virus is not a good thing to have happened to our country.
I agree, sir. Absolutely. And, of all these things which you narrated, one of the things which I have also seen and where I would want some very pointed advice from you, for our audience is teenage and early adulthood is anyway a time of turmoil, right? It's not fun to be a teenager in India right now. I mean, and it wasn't even when you were saying in our 10th and plus two. Well, yours was probably more fun than mine, but by the time I was in my plus two, I was under immense pressure to crack entrance exams with the competition, increasing. Well, I had uncertainties, but right now the uncertainties have gone to a different orbital altogether, right? And this thing which you flagged of not all home environments being conducive, positive and nurturing, you know that sharing a small cramped accommodation probably with parents and grandparents and siblings, and fighting over probably devices or wi-fi speeds, and sharing household chores, right? All of these, while being uncertain about what the next 1 to 2 to 3 years will bring in terms of your career, because this is the most important time of your career. So for these people, right, these youngsters whom we like to call as the future of our nation, it's very difficult to see them in this uncertainty. What would you advise? What should people be doing, or students be doing?
Okay, so a couple of things in general. Number one, I think the only thing that really sustains us is the fact that nobody is being singled out. It's not only
Yeah.
affecting me; it's affecting my school, it's affecting my college, it's affecting uh, every country, every city in our country, it's affecting every state in our country, it's affecting every country in the world. Some people seem to have coped better, some people haven't. But the bottom line is that is what it is, that we are having a whole bunch of people who are in the same boat. Now, it doesn't make it easier for me, but it makes it easier for me to some extent to know that I haven't been singled out. Because if I get singled out, then I'm going to be devastated, but I'm not singled out. Everybody else has the same situation. Now, Satyan, you're aware of the fact that the Indian Psychiatric Society had started a whole bunch of helpline services when the pandemic started, and
Yeah.
the central government had very kindly given permission to do telemedicine so that people who couldn't travel and reach their doctors and who still needed medication still had access to the doctors online, and virtual
Yeah.
prescriptions were accepted. Now, I had started in my city, etc. I had started 5 helplines, and they were quite big. And in them, one of the things that kept coming out over and over again, and this is what I want to emphasize for students who might be watching, or for the parents of the students who might have logged on to what we are saying. The thing that makes a difference to everybody, especially the college-going student, is a feeling of connectedness. So we have to
Yeah.
realize that we are not in isolation. We are not doing things alone. We should not consider ourselves to be in individual little silos or individual little, sheds, and everybody is looking out at the other person and not interacting with them. That doesn't work. I remember when the pandemic had started, and we had we had gone to we were going to the hospitals, and the roads were deserted because there was tremendous lockdown, and we were stopped at regular intervals by the cops. who were doing a fantastic job, by the way, in checking and seeing that people were not, getting out unless it was absolutely essential. That was the time when I had spoken about my colleague with my colleagues in my city about what was happening, and one of the senior guys actually told me. He said that what he did was he carried with him some bottles of water and some bottles of lassi, and he would stop whenever he was stopped by the cops. He would kind of give one of them to the cops and say, "Thank you, you're doing a fantastic job." And I started doing the same thing, and it was wonderful. That
It
connectedness
is.
was lovely, right?
Right.
We started doing it with our college going kids who are part of the various helpline groups that I had started, and we told them that please look at the fact that sometime someone in your building maybe might be staying alone. Now he's an older person. Maybe his kids are abroad, or his kids are in another part of the city, or his kids are in another city in India, and he would be having normally people coming in every day, a helper coming in, maybe family members coming in from another part of the city, and they would interact so that he would always be connected. And now suddenly all of that stops, and people are not
Yes.
coming in. If he needed help, maybe the helper was not coming in, not because the helper didn't want to come in, but there was no transport, or maybe the building did not allow the person to come in, and he was all alone. And we told the teenagers that just connect with them in your own building, and even if you have connections with the buildings around, and just tell them that you're there and that you're thinking of them, and if they need anything, that you're available and you'll try to help to the utmost. We did not want for them to go and meet them, because they could be a carrier, and older person, less immunity, and all of that. But the very fact that you could connect on to people and just tell them that you are there and that somebody's thinking of you, I think makes all the difference in the world. And we found a tremendous change in the way people were looking at each other. And that's where teenagers do a fantastic job. So this whole myth
Yes.
of teenagers being selfish and they don't care about the world is all bunkum. I think teenagers do an enormous amount of good stuff. And our college kids
Yes.
are fantastic.
I totally agree with you. Yes, and I share your optimism for the newer generation, for these bright, wonderful young people. They are better than us. I can definitely say that, and they're better than us at picking up good things and running with those ideas. And yes, when calamity strikes, we rise up as society. We rise up as one, and we're in the same storm. So we look out for each other. Little acts of kindness. They will go a long way
I
in
definitely agree.
restoring our faith, which we need to establish with our youth, is by trusting them to be the force for good. And that's, I think, where the elders of the society and the people who are the decision makers, they need to invest more faith in them. But at the same time, now coming to the flip side, coming to our core topic of mental health, Dr. Kersi, what do we need to look out for as mental health flags, when it comes to our youth and people sitting at home uncertain about their future and dealing with such complex emotions at an age where they should probably not be dealing with it? What to look out for? What can friends, families, and well-wishers need to know?
Yes. And that's a terrific question. And I'm so glad you asked that. Now, I mean, we're all aware of the fact, for the audience, let me repeat this, that about 25% of the population at any given time will be having some kind of psychiatric illness or psychiatric manifestations of an illness, which are probably not going to be looked at. And we have access now to more and more people and more centers and more helplines. So it would be stupid of you to tell you, uh, that it would be stupid of me to tell you that you can't get access, because you do get access. Now, one of the things that we look at in terms of the mental and all the psychiatric manifestations, given the fact that anxiety and depression are the two commonest psychiatric illnesses, what are the things that we should look for? Now, you should actually look for something that is happening which causes a person to have a deterioration in the way he or she lives his life, his occupation, the way he's working, the way he's studying, the way he's socializing. He might have a problem just in general where he just says that things have changed.
Yeah.
So if we are looking at the kind of signs and symptoms that we should look for, if you're looking at anxiety, then we look at a situation where a person has a feeling of impending doom, that something bad is going to happen. Yes. So we are looking at a situation where we have a problem related to feeling of not feeling good, a feeling of anxiety, a feeling of ghabrahat. Sometimes this ghabrahat reaches such an extent that you land up getting a feeling of palpitation. You get these cold and clammy tremors. You get sometimes a chest pain. And because of the chest pain, you land up rushing off to the hospital because you believe that you might be having a heart attack. So now we talk, so one of the things that happens in anxiety, especially if you have severe anxiety, is what we would call a panic attack. And that panic attack is something which happens where you actually land up going to the hospital and you think that you're getting a heart attack, but you don't have a heart attack, you just have a panic attack. We also have depression, and depression is extremely common, where there's a general feeling of lack of satisfaction with what is happening. There's a feeling of not being motivated to do stuff. Sometimes it's so difficult that you can't even get up from bed in the morning. It's so difficult that you don't feel like attending college, you don't feel like eating, you don't feel like doing the normal biological functions. You stick yourself into your bed and you don't get up at all. These are the common things that we would see in terms of depression. And one of the frightening things associated with depression is suicide. So we have a lot of people now who actually, because of whatever is happening, feel scared in terms of in terms of wanting to kill themselves because they just feel that life is not worth living.
Yeah.
Another common situation that we find ourselves in is OCD. And OCD now is becoming very common. What normally happens is that you get this thought in your head or an idea or an image or a perception that there's something happening, which causes you a lot of anxiety. So if you're looking at it in terms of, for example, that there's something dirty or my virus is getting at me, then I'm going to start hand washing. And I hand wash in a particular way. And then when I start hand washing, I find that it's kind of causing me an enormous amount of relief. Looking at it in terms of OCD, we are looking at it in terms of something that is happening that causes a problem and makes me feel in a particular way. So I start doing stuff that would reduce what is happening. So I would start hand washing, and I hand wash in a particular way, which we call a ritualistic fashion. And when that ritualistic fashion happens, it reaches a stage where I start doing it over and over and over again. Now, we've been seeing a lot of OCD in terms of hygiene, that kids start hand washing and cleaning themselves over and over again. And we are also seeing it in terms of religiosity, where because we are so scared, I start, taking recourse to religion and constantly praying and things like that. And I mean, it's nice to pray. We all need support, etc., etc. And we might pray up to half an hour a day. But if you're praying 8 hours, 10 hours, 15 hours a day, then obviously that becomes a problem. So this is one of the other things that we see which can cause an issue. I've already spoken a little bit about aggression. That is certainly one of the things that we should be looking at. And we are also seeing a lot of people who are now taking recourse to drugs and alcohol much more than in the past. Satyen, maybe you'd like to talk about it since you have so much experience in it. Yeah.
Right. So adding to that, sir, of course, what we know is that the lockdown situation is not the best of times for patients or people who are in an abuse pattern, right? People who had been off substances for quite some time, because of the stresses which increased during the lockdown days, have had relapses. Also the quantity of alcohol, especially, which people earlier limited to a social interaction or once in a week kind of a thing, now we are seeing that because of the lockdown, both the number of days of alcohol use as well as the quantity of alcohol definitely is going up. And along with that, what the attendant risks of alcohol, domestic violence and making the home environment not conducive for children, and all kinds of increased trauma, that is what is coming out. Also, interestingly, sir, what I have also noticed is an increase in hypochondriasis, into believing smaller symptoms to be something very severe, and mostly again centered around COVID. You have one sneeze and you say, I've got COVID. That's very commonly, which I'm sure you must also be experiencing. And I think what we will have to deal with over the coming few years, if not decades, would be the post COVID trauma. Very close to PTSD, shell shock, very close to survivor's guilt, and the loss of life, and I don't think anybody is untouched. We all have a friend or a family member or a friend of a friend, somebody we know in our first degree line who has succumbed to COVID. And it requires a certain adjusting for all of us to do. And for the young, it hits doubly hard, right? Because along with this grief, along with having to deal with so much of negativity which is right now in the environment, they are also facing a lot of uncertainty of the future. So if I were to try and guide you towards the next question, sir, I would like to ask that most of us now, professional psychiatrists, we depend on our medicines, for delivering solutions to mental health issues, problems, diseases which we diagnose and we treat. And our medicines, I mean, you know it and I know it. Being a second generation psychiatrist, I have seen my father when he joined his post graduation, they had 3 molecules and ECT, right? Today we have, I think, 200 plus molecules and more coming in every day. So would you like to use this platform, sir, to remove some of the myths and misconceptions which people have, even when they're suffering and clearly are able to see that something is seriously wrong with my mental health? The myths and misconceptions, and to some extent the negative connotation of psychiatry, even amongst physicians and doctors, that keeps them away from taking medicines. So I would need your experience and for you to weigh in on this matter. What are the common misconceptions people have about psychiatric medication? And please let us know. Yeah.
Okay. So I think that is probably one of the most important statement that we'll be talking about over here. Everybody is scared of psychiatric medication, and it's, whenever you talk of psychiatric medication, it becomes, oh my God, what will happen? Will he become an addict? Will he sleep the whole day? Will I put on weight? Will I come under your power? And everything else that you can think of. And I only say one of the things, it's like, yes, everybody who comes to me doesn't get medication, but a huge number of people do. So it's like, supposing you had a fracture and you go to ask somebody, what should I do? And that person says, get an operation. And if I tell you, go do yoga because you have a fracture, you think I'm a nitwit. And that's exactly what happens when people come up to us and say, oh, my guy is psychotic and he can't identify people and he's listening to voices in his head and he's convinced that people are sending him messages through the radio and things like that. Can we do counseling? No, you can't do counseling. Counseling is not going to help the situation. You're going to need medication, and the medication is a must over here. Counseling might help the medication, but you cannot expect that it will do the job that medication does. Now, this whole thing of will I get addicted to medication? And I keep telling people, a huge number of us have diabetes. They're on anti-diabetics. Are you addicted to the anti-diabetic medication? No, you're not. A huge number of us have blood pressure issues, and you get onto antihypertensives. So you get into this thing of, I have to maintain my blood pressure because if my pressure is not maintained, I'm going to land up having a whole bunch of complications. Does that mean that you are addicted to the antihypertensive? No, you're not. There's a large number of people who have a thyroid problem, and they will take a thyroid tablet for the rest of their lives before breakfast. Are they addicted to a thyroid problem? No, they're not. But somehow, if I give a tablet, they become addicted to it. And I don't understand what the difference is. It's still going to act the same way. And I asked somebody, I said, what is this thing of addiction? And they say, sab log bolte hai, they say. And I get into who's this they. Now, nobody knows who this they is. But this they is a very important person or a very important set of people. And because they believe a certain amount of things, we have to not look after ourselves, not take a tablet which will make all the difference in the world. And please do realize, like I said right in the beginning, none of us live in isolation. So if I get affected, my whole family will get affected. And if my whole family gets affected, that's not very good. And if by taking a tablet, my problems stay under control, then it should also help the rest of the family. And that becomes something that we should be looking for. So that is one of the things. The other thing that we talk about is good old Dr. Google. Now, Dr. Google is about 18 years old. I was a little surprised because I thought he was much older, but he's only about 18 or 19.
Right.
But Dr. Google knows everything about everything, apparently. So it's so sad that my 35 years of clinical experience, my 35 years of seeing patients, my 35 years of seeing the complications of medication, my 35 years where we've talked about cases, discussed cases, had clinical meetings, done continuing medical education programs, stands for nothing because your 15 minutes on Dr. Google makes you proficient. And I often tell people, I hope when you have a fracture, you put your hand in front of the net and you just say, Dr. Google, put a plaster around me. I mean, it's insane, it's ridiculous, it's stupid. Yeah. One of the things that people also say is, but your medicines work through the mind. I agree. They would work on the mind, they work on neurotransmitters, they work on electronic circuits in the brain, they work on a whole bunch of other things, which we are now finding, given all the new research that is coming through. But guess what? A lot of anti-diabetics work through the brain. A lot of antihypertensives work through the brain. The thyroid works through a release factor which comes to the brain. But somehow that's okay. But when you take my medication, it's not okay. And so get over this thing of it not being okay. How long should you take it? Depending on the situation, but a huge number of people, for the first time that you take the medication, you should take it for a period of at least 9 months to a year of stability, and then you try tapering it off. When you taper it off, maybe about 40 or 50% will not have a problem in the future, and about 50% will. If they have a problem in the future, we need to continue the medication, but it has to be under supervision. There has to be monitoring by a psychiatrist. So it cannot be, I saw you 5 years ago, and I'm continuing with the medication, and now what am I supposed to do? So I say, I have no idea what you're supposed to do, but you should have met me at regular intervals, which is very, very important. So those are some of the things that we see related to medication. I'm sure you'll have some more, Satya. Maybe you can add to what I'm saying.
I only find myself nodding at every point because absolutely, yes, I share your frustration. I share your, anger and anguish, at this question being asked. And I think part of the answer lies in taking that myth and mythology around the brain. Let's let the brain be another organ, and that's it. And I mean, I love to use this line over and over again, that we have gone in terms of psychoanalysis to modern psychiatry from the brainless mind to the mindless brain now. Let's talk brain. I cannot see the mind. I don't treat the mind. I treat the brain, which in turn controls your behavior. And when it comes to medicines, Dr. Kersi, when your ENT guy tells you you have to eat antibiotics for 7 days, it's no pleasure. But you take your medicines for the entire course of the time. I tell my patients that, come, let's go to the closest department of surgery and look at all of those 20 people lined up for surgery today. Find me one who wants to get that surgery done. Obviously not. तो दवा मजबूरी में खानी पड़ती है, लेकिन trust your doctor. Addiction is when you are taking medicine without the doctor's prescription. That is addiction, right? That is misuse, that is abuse. But when a doctor is writing it on a prescription, he's taking all responsibility for that medicine. Or जो आपने कहा ना, वो लोग, those people who apparently are very important but very invisible, to that I have one counter. I say, in India, even if you ask the rickshaw wala some treatment for cancer, he will also give you something. It's not that he's going to say, I don't know, boss, ask an expert. He'll say, हमारे वहां पे भी एक बाबा जी हैं, बरगद के नीचे बैठते हैं, go meet him, probably he will cure you also. But it's up to you, the end consumer, to make yourself aware about the science, about the evidence, and then choose your specialist. And then, this I like to say over and over again, don't take mufat ki salah. Pay for it and get it on a piece of paper. Pay for the prescription, get authentic information. Mufat ki salah can be extremely dangerous. If somebody is insistent that, that no, you don't know, this is how these things work. And then when it is communicated to me, I say, okay, please go to that gentleman or that lady who says this medicine is dangerous and tell him to give it to you in writing, right? Because
Very
I am giving my medicine in writing. I am taking full responsibility for it. Yes, there can be, in some very rare cases, there can be medical misadventures. There can be unknown side effects which might happen. But then, we live on faith and we do things in good faith. So let's try to put our faith in specialists, talk about it, accept the diagnosis, accept the medication, come back on proper time when the follow up is supposed to happen, and get out of it. There is no need in today's world to suffer unnecessarily when treatments are available. So
absolutely.
that's how I try to do it. And you
And
know,
there's one more thing that we have to also talk about, and that
Ji.
is, for example, the person is okay. So, doc, I was feeling very bad and I'm feeling very good now. Can't I stop the medication? And if
Yes,
I say no,
yes.
that becomes a problem. But then you look at
Hmm.
it like this: supposing you are hypertensive, and with a lot of jugglery, I managed to get your blood pressure under control, and it's now under
Hmm.
control. You stop the medication. The doctor will say no because
Absolutely
it'll
not.
come back up. Ditto for
Right.
diabetes, ditto for a whole bunch of other things. Well, guess what? The brain also functions like that. So if you're going to need medication and you're going to need it for a long time period and the doctor says you have to take it,
Yeah.
then I might be kicking my legs up and dancing with joy, but I might still have to take a tablet which maintains that.
Yes.
And that is so.
Yes. And at that point in time, sometimes, I do like to, and I think we should. Dr. Kersi, you know about it, being a personal friend. You know that I have had my battles with depression. I have gone through it. I have taken my medicines. And there are times when I am taking medicines and I tell my patient, I have depression right now, but I'm sitting and being productive because I'm taking my medicines, right? This is what medicines do. You are feeling okay because you are on medicines. It would be extremely stupid to let go of the medicines because now I'm feeling okay. you know so that I think education over time will happen. Thankfully now we have a lot of celebrities, in the past, from Bollywood. Deepika Padukone came out and was brand ambassador for the IPS, in terms of,
Sure.
well, I had depression. With all the success a person could hope for, she had depression and it is okay, right? And now lots of sports persons have come forward. I think a lot of doctors also are coming forward. There are a lot of psychiatrists I know, and my respect for them increases when they are able to make peace with the disease, of peace with the fact that they are human, right? That being human, they are as susceptible to any human disease as any other person. So yes, sometimes I do share that. I openly talk about it, and I say, fine, it's okay to not be okay.
Okay, may I just suggest to that again the thing get locked because we are having again some people popping in, which is going to cause a
Right.
problem. So the organizers,
Hmm.
please keep it locked, please. It's coming in again, and
Right.
it soon loses its charm. Yeah. Um,
I do realize that.
yeah.
So
Uh,
I think, Dr. Kirsi, mostly for today's topic, we have covered most of the ground in terms of the challenges which young college-going crowds are facing, what signs to look out for, removing misconceptions about medication, about treatments, right? Any parting message you would like to
well,
give
one of the
to,
things, yes, I think
yeah,
what is also very important is for us to be aware of the fact that we are creatures of habit. So it's absolutely
yes,
essential, even if you're sitting at home and not attending college, that you have a kind of a structured to your day.
Right.
So there should be a time of getting up. There should be a time of going to bed. There should be a time of doing a whole bunch of things on a regular, proper basis, rather than just saying that, "Acha, theek hai, abhi I don't have to do anything uh, because I don't have early college and things like that." So that becomes a problem. The other thing we are
Right.
looking at also is some amount of physical activity is probably a must for college going kids, because it helps to channelize some amount of the negative energy which otherwise would have been uh, would otherwise come out in inappropriate fashions. So that is what we are looking at. And the third thing that we are looking at also is we are looking at the necessity of being aware of the fact that there is light at the end of the tunnel, that it is going to change. Eventually, we will become okay. Eventually, we will reach a stage where things will come back to normal,
Yeah.
and we've got to survive what we're going through. So let's survive it well.
Yes, yes, absolutely, sir. Dr. Kersi, it's been a pleasure. Absolutely. I mean, barring whatever little interruptions we had, which I think I will squarely blame on your celebrity status. Too many people follow you. And what I at some point later, what I would really want to talk to you about is another very important topic where your own lived experience I would like to use, in terms of the responsibility of media in portraying mental health. At some point we would want to do a little session on this. Probably the next time we do it purely as a recorded session itself and not open it to the public, and then edit it and then release it on mass media.
Sure. Now
But
we've got
So,
Lakshmi
Dr.
who's asking.
Dr.
Ji,
Satyen
ji.
Sharma and Dr. Kersi Chavda, thank you very much, sir, for coming to the show. There are few questions that we have from our viewers today. In case your time allows, we can.
Yeah, of course.
It says that when is the right time to stop medication? Perhaps one of the top questions. I think most people always are, in some sort of a confusion that how do you consider a right time when you should just stop taking medicines.
Yeah. Yes, Lakshmi, it's perfectly okay for you to eat Odomos. You're more than welcome to have it. When we are talking about the question that was asked in terms of the time period, like I've already said, that we would normally suggest, depending on the situation, we give medication for a period of 9 months to a year, and then we try to reduce it. If it works, great. If we taper it off, and if you're still feeling okay, that's great. If you're not feeling okay, then you might have to continue with it for a longer time period. So there's really no right or wrong in this. It is what the doctor feels, what he sees, given the fact that everybody has to react in a particular way and will react in a particular way, dependent on his genetic makeup, dependent on the experiences he or she might have had. It's going to be different for everybody.
Right, right. And again, let me stress this. The brain, while it's one of the most, it is rather the most complex thing in the known universe, the human brain especially, right? So there cannot be a one size fits all solution, and psychiatrists and specialists have to tailor make a treatment plan according to the client, and every client, every patient will have a different set of circumstances to deal with, right? So the question is hugely subjective, but be prepared that the treatment will go on for weeks to months. I mean, not even weeks, months, when it's a first instance. And if there are repeated instances and where we identify that there is a certain vulnerability, so the doctor's idea, the doctor's mission always is to protect you from that harrowing experience. I mean, having a panic attack is no joke. It's like going into a near death situation. And I would not, I mean, I've never had a panic attack myself, but the patients and the condition I have seen, I would not wish anybody to go through it again. So I will err on the side of caution. I will not want my patient to ever experience it again, right? And neither would they, because one panic attack can disable you for several months. It can shorten the horizons of your life. It can actually make you take decisions out of fear instead of out of hope, and that's not a good place to be in. So our job when we are creating treatment plans is to see that we set up this person for life on the path to wellness. And if one has to pop a pill for that, maybe every day for the rest of your life, not a very big price to pay, right? In the end, we need to be functional. We need to be operating on a higher level as human beings. Right, Dr. Kersi? Although it went a little.
Absolutely. Absolutely. Absolutely.
Right, right. And sir, again, sorry for the interruptions of today. Lokendra, do we have any other questions which we might want to ask our guest for today?
Dr. Satyan, I think, for now, we have taken the questions. These
Okay.
are many questions that we have received from the
Yeah.
viewers. We'll try and respond to them via email because the
So
session,
one more,
right.
just one more. It has popped up from Deepika. And since Dr. Kersi is here, I would shoot it at him. We won't get a better expert to answer this. Sir, Deepika is asking that, but medicines have side effects.
Right.
Yes, please answer
Well,
that for her.
yeah, so that is true. And sometimes we actually utilize the side effect. Now, I don't think I'm erring on the side of medication. Please believe me, everybody who comes to me doesn't get medication, but a large number of them do. And if I give it after I think it out. Now, you take a crocin for a headache, crocins have side effect. You take a vitamin to feel better, vitamins have side effects. But we don't think too much about that. The commonest side, now I don't just give a medication. So for example, if I feel you're depressed, but you're sleeping too much, I might give a medication that will reduce your sleep and at the same time make you feel less depressed. Deepika, you're constantly saying all of this. I don't know. They are long term, etc., etc. I don't know whether you'd prefer to be depressed and suicidal rather than take a medication which makes you maybe put on a little weight. If the comparison, I don't think really there's a balance in that. So yes, there are side effects. The side effects are there. The side effects will be looked at. We would do whatever we can to minimize the side effects. But what can I say? Vitamins, calcium, stemetil, antihypertensives, and anti-diabetics, thyroid issues, they all have side effects. Nobody gets too hassled about them. Somehow they seem to get very hassled about the medication that we give. Given the fact that we have to find the balance, then it is essential for us to do the best that we can and to see that we give the least amount of medication, get the best amount of positive effects and the least amount of side effects.
Yes. And always, when we are creating a treatment plan, Deepika, we always have to, every good doctor has to weigh the cons and the pros in terms of what medicine to choose, what is the age of the patient, what is the side effect profile of the medicine. And like sir said, there are some side effects which we actually use to benefit the patient, right? There are n number of medicines whose side effects make them much more desirable. For example, and this example, I'm sure sir will agree with me, a certain class of medicines called, and I do not mean that you start taking the medicine for its side effects, because please remember, medicine have effects also, right? A certain class of medicines called as SSRIs cause a side effect of delayed ejaculation, right? So a sexual side effect. But there are patients who come with premature ejaculation where we use the side effect of this medicine to cure that condition, right? And several more, which would not be in the scope of this one short meeting for us to answer. But the idea is that trust your doctor. He's done a lot of study. He's updated himself on a lot of evidence-based journals and articles, and he's here to help you operate, function, feel better. So we will, Dr. Kersi, sometime again catch up on this very important topic which we talked about. And definitely do it in a setting where you will not be disturbed with this. Thank you for your time. It's been a
Absolute
pleasure as
pleasure.
always. Yes.
Thank you everybody for being supportive and tolerating the mentally disturbed people who got onto the show. Thank you so much. All the very best. Cheers. Be happy. Bye.
Thank you, sir. Thank you so much. Bye bye.